of its basic site in Amasya. It all sounds like a story. It is an advantage of Ayurveda, and it is many times, or at least sometimes, this is the tough part of Ayurveda as well. Because we are storytellers. So certain amount of imagination is a must. When we say that Agni is situated in Amashayam, you should have something in your imagination. Similarly, when you say that, okay, this Dushta dosha is afflicting the Agni, and that is causing problems with the rasa, and it is transferred to the rasava srodhas, causing its pidhanam, then Agnimandyam, accumulation of ama, dosha getting entangled or attached with the amam, then the Agni is becoming displaced from its seat and it escapes to the outer part or the periphery or outside the costum. So practically there is no Agni in its base headquarter, as if some sort of a some military coup or something like that happened, as happens in certain countries, displacing the existing ruler. They run out of their capital, and these rioters, they occupy their seat. So practically there is no ruling inside, whereas the ruler is running outside. So in the same way, there is no Agni in the costum, in the Amashayam, but meantime Agni is wandering in the periphery. So this idea is very important, because the entire concept of Nija Jara Chikilsa revolves or spinning around this idea. So we should have some good picture based on this explanation of Jara Samprapti. It is because of this involvement of Amasya Dushti, Agni Dushti, Amam, that the Samanya Chikilsa of Jaram is so specific in Ayurveda. That is very important. You know, in this present pandemic situation, again it was a testing time. Considering this as a viral fever, I don't want to go to the controversies behind the idea whether it was a normal viral fever or it was a manufactured fever or many other conspiracy theories. I'm not going to it. But considering this as a fever with the viral background, nothing more, the patients were given with high protein diet. I do not know. I have not yet reached that level of understanding. How do you treat a Jvarita with a rich, high protein diet, which is very difficult to digest? Of course, even in Ayurveda, that concept can be seen. Shuddhavada kshaya agandu jirna jvarishu langhanam neshyade teshu hihidam shamanam yanna karsanam. True, fine, great. But even in such situations, you see the word used, shamanam. Shamanam has 7 types. Conventionally, we learn 7 types of shamanam. Pajanam, Deepanam, Kshutrad-vyayama, Adapamaruta. But all these are Karsanam. So there is an 8th type of Shamanam. That is known as Brahmanam. Brahmanam Shamanam tu eva vayoho pittanilasya. So when you say that Shamanam yanna Karshanam, indirect meaning is Brahmanam. But the Acharya did not use the term Brahmanam. He could have easily accommodated based on his literary skills. It was not at all a difficult issue for an Acharya like Vagbhada to include the word Brahmanam in that sloka. But he did not. Instead, he used Shamanam yanna Karshanam. So even if that Brahmana is advised, this type of explanation, Shamanam yanna Karshanam, makes it a very crystal clear idea that even if you are going to give a high protein diet which is very rich and tough to digest, you should have a consideration of Agni. Because basically, Jwara is an Amasya Ashrita Vyadhi. Amam, Amayam. Jwaram is one of the classical Amayam. So without considering the status of Agni, you cannot do anything. That is very important. We will find many situations in support of such a stand. We will come to it. On the other side, when you have a Ananda Jwaram, its Samprapti is also important. Ye bhuda vishavayu agni kshada bhangadi sambhava kama krodha bhayadyascha tesir aganda vogana. That is how aganda is explained. And in the aganda jwara, we have seen 4 subtypes. And we saw that in Nija jwara, we need a dosha dushti, then its specific Amasya Pravesham, and a series of events subsequently. But in the event of an Aganda Jwara, it does not seek a pre-existing dosha dushti. Aganda Jwara does not seek a pre-existing dosha dushti. That is why it is told that Shuddhavada Kshaya Agandu Jirnajjarishu Lankhanam Neshyade. It does not seek a pre-existing dosha dushti getting attached to the Amashaya, causing afflictions with the Agni. So there is no meaning in going for a Lankhana Chikitsa targeting the presence of Amam in the Amashaya. It is a guest affliction. Bhudam, Visham, Vayu, Agni, Kshadam, Bhangam, Kamam, Krodham, Bhayam, etc., etc., etc. In Jwara we will find Oshadhi Gandham, Visham, Vayu, Agni. These are all examples. Take the case of Kshadam. It is a roga because it causes pain. Ruk, Rujandi. And to get afflicted by a Kshadam, you do not need a pre-existing dosha dushti. You are beaten by maybe a thick wood log, something like that. You do not require a pre-existing dosha dushti to get afflicted by that kshatam. On the spot, immediate effect, you have pain. Sometimes it may be a wound due to the kshata. It may be a wound sometimes. Then we call it as a sadhyovrana. Sadhyovranastu sahasa sambhavandi abhikhadatah sadhyo sambhavan. So it is a wound. And this sadhyovrana obviously causes the dhatu kshobham, no doubt. It causes dhatu kshobham. Sometimes it damages some organs, sometimes some srotas. This causes pain. The functional status may be deranged. Loss of function can happen, which can be either permanent or temporary if you are lucky. And in a normal individual, the so-called a healthy individual, this vrana heals, the pain subsides, and the functional status is restored to the best level possible. Isn't it? The functional status is restored to the best level possible. But due to some issue or some factor influential, if this process of healing and functional restoration fails to occur, then the kshobha of the dhadus and the related tissues connected to that initiates a dosha dushti. And that dosha dushti gets attached to the vrana. That gets attached to the vrana. Now it is no more a Shuddha vrana or Sadhyo vrana. It is a Dushta vrana. When it is attached to a dosha dushti, it is known as Dushta vrana. I am explaining vrana because it has got all similar explanations as jvara. In vrana we find nija agandu division and also another division called shuddha and dushta. Doshair adhishtido dushtaha shuddhastair anadhishtitaha. In the same way, we can consider jvara also. This differentiation is quite interesting because when there is a, as I explained earlier, when there is a sadhyo vranam or kshatam, whatever it is, it tends to heal by its own, maybe with the minimum intervention, causing no involvement of dosha and not becoming dushta in a healthy individual. This is a standard practice. So this happens in the case of jvara also, agandu jvara. When there is a pre-existing dosha dushti, please listen. When there is a pre-existing dosha dushti, still you can get a kshatam. A person with a pre-existing dosha dushti, like any other person, is prone to get a wound. But in such a situation, this vranam caused by the kshatam tends to become a dushta vranam very fast, because there is already a pre-existing dosha. Similarly, the most important stand that a Vaidya should have in the event of an Agandu Vrana is the avoidance of becoming a Dushtavrana. When a Sadhyovrana, a Kshata happens, that means an Agandu factor comes. The first priority of the Vaidya should be to heal it as such, as a Sadhyovrana, and avoiding it getting entangled later with a Doshadushti. Similarly, in a person with established Nija Doshadushti, we should have a priority of avoidance of exposure to Agandu factors. That is where the preventive strategies are important. So these things are similar to the Vrana and Jwara. We saw that there are 4 types of that Agandu factors documented in the textbooks. Of course, we have to make many modifications in it. For example, see in Abhighadam, we find that Kshadacheda Dahadir Abhighadajaha Sramacha. So assault, physical as well as mental. And in that physical assault, we find agents, physical agents like Kshatam, which can cause Kshatam. So there may be a weapon, fire. And now we will have to consider even electricity, radiations. Similarly, Abhishanga Jwara. Abhishangam means the close contact, union, attachment, association. All these are the meanings of Abhishanga. Of course, Abhishangam is a word having many other meanings. Forget it. In our context, this is what is relevant. Grahavesha Ushadhi Visha Krodha Bhi Shoga Kamajaha Abhishanga. Then the other 2, Abhishapam and Abhichara. I am not going to discuss them in detail because they are more about the mental aspects. In all these types of Agandu Jwara, the initial phase is of an affliction, either physical or mental, causing, I hope you can follow, causing manifestation of symptoms which are cause specific. Of which Jwara will be the most important one. Please take care, please listen. In all these types of Agandu Jwara, initial phase of affliction can cause manifestation of symptoms which are cause specific. But subsequently, it evolves into a Jwara of Nija type, where the host factors also come into the play. Host factors like basically, of course, the dosha, 3 doshas, then the balam, ojas, vyadhikshamata. All these factors are going to play critical roles. They are closely interconnected. They are very closely interconnected. Like, see, even though the Agandu factor is getting an entry into the Sharira through some or the other port of entry, and it starts creating issues, symptoms which will be more indicative of the size of the type of the Agandu factor. If there is proper bala, proper ojas, proper vyathikshamatva, the doshas will be protected. Doshas will be protected. So at any point of time, preserving the bala is becoming one of the major targets. Balam yatnena palayan. Preserving the bala. Baladhishtanam arogyam. Arogyartha kriyakrama. So if these factors fail, obviously that host factor, especially the tridoshas, will become the targets of the guest factors. That means the Agandu factor. Aganduranvedi nijam vigaram nijastadhagandum adipravruttha. A strong Agandu factor can follow a pre-existing Nija disease, and a Nija disease well evolved may join league with the Agandu disease. They tend to get entangled with one another very easily. In the event of an Agandu Jwara, if the exposure to the Agandu is established, let it be Shatam, let it be Visham, let it be Agni, let it be Vayu, let it be SARS-CoV-2. I already mentioned that there shall be manifestation of symptoms which are indicative of the Agandu factors. And as long as the Nija doshas are not becoming dushta or not getting attached to the Agandu presentation, condition can be managed with the cause specific. Please listen, the condition can be managed with the cause specific and site specific interventions. That is how Gandusham and Nasyam, all these things, practices of Dinacharya became so significant in our times of pandemic. That Agandu specific and site specific interventions. As you all know, there is a chapter called Trishobhiyam in Charaka Samhita, in Sutrasthan, where Agandu Shobham is explained. Te punaha yathaswam hedu vyanjanaihi adau balabhyate nija vyanjanaigadesha viparidaihi. Continues. Bandha mandra agada praleba pratapa nirvapanadibhihi cha upakramaihi upakramyamanaha prashantimabhadyante. Te punaha yathaswam hedu vyanjanaihi adau balabhyante nijam vyanjanaigadesha viparidaihi. And they respond effectively, they respond very easily with the interventions like Bandha, Mandra, Agada, Praleba, Pratapa, Nirvavanadibhihi cha upakramaihi upakramyamanaha prashantimabhadyante. Site specific. In the case of Shobha. In the case of Jwara, we should. Shobham is another important idea in Ayurveda. Shobham. there are some concepts like the manifestation of a Shobham is there in the first phase of all diseases. That is also very important. So in the case of Agandujjara, if you look into the Agandujjara's Lakshanas, some way or other, you can identify a Shobham in it. Presence of a Shobham. So in Agandujjara Chikitsa, Agandu Shobha Chikitsa is very important, is relevant. So site-specific interventions in the first stage. In the specific context of Jara, avoiding the association or involvement of the doshas to the Agandu factor which is already operational is very important. In viral fevers or fevers of similar origin, sometimes we may not be able to avoid the potential exposures in our day-to-day life, but definitely you can avoid the possibility of the Agandu factors disturbing the Tridoshas. If you look into the practices in Dinacharya, in this background, you will start seeing them in a new light. That is very important. So, the important aspects to consider is avoiding specific nidanas of doshagopa, even if you are getting, see, Janavadodhamsaniyam. We are forced to live in the same place, no escape. Then what you can do, or what you can advise as a Vaidya to others? Okay, let us take this for granted, no issue, but there are certain things which are under our control. We can avoid potential doshakopanidhanas. That will make a big world of difference in the outcome of the problem. Maintaining Sharira Bala. Actually, Sharira Bala alone is not sufficient. Balam, I think many a times we find this Bala explained in different, with different prefixes like Deha Balam, Dhadu Balam, Agni Balam, Sattu Balam. Deha Balam, Dhadu Balam, Agni Balam and Sattu Balam. All these four are important when you have a potential exposure to Agandujjara factors. Then maintaining the Amashaya healthy and clean. Because as long as your Amashaya is not permitting the entry or not receiving the Agandu factor and the potential dosha dushti in the initial stage to get lodged there, the possibility of a Nijajjvara to make the situation worse can be avoided. And most importantly, taking all these things together, avoiding the formation of Ama and Damas. In our present context of COVID-19, if you make a serious look into what was happening in the hospitals everywhere, by improper practices of dietetics, they were bringing in enormous amounts of ama in the amashaya of these patients. People were given with high protein diet like meat, eggs, milk. And that was inviting issues actually. Only those who had some good bala otherwise or sara, they came out of it despite the disease and the treatment, despite the disease as well as the treatment. Those who could have escaped from the disease failed to escape from the treatment and they succumbed. That also happened. So the concept of Ahara, Nidra and Abrahmacharyam, which are supposed to be the three pillars on which the body is kept healthy and intact, that is to be put into practice here. I do not know whether you have noticed it or not. In many of the directives published by various ministries during the pre-vaccine period of the pandemic, we were talking about immunity for the first time, even if that word immunity was creating a lot of contradictions, a lot of issues. The word immune booster was cut into pieces and analyzed from various perspectives, whether it is a proper usage or not. Forget it. The basic idea is to improve the balam. And for that, the role of Ahara, the role of Nidra were discussed. Still, we have to discuss the role of Abrahmacharya or Brahmacharyam otherwise. Upavasa Rupa Lankhanam is very important if Ama is formed. If Ama is formed in the Amashaya, Upavasa Rupa Lankhanam is very important. In the incident of an exposure to an Agandu factor, immediate Upavasa may not be required or may not be even advisable, because Lankhanam of any sort may be causing significant Balakshayam, as it is a Karshana procedure, and it can cause a fall in the Vyadhikshamatva. But so in the preventive strategy, you are not supposed to go for extreme Upavasa. But if the situation turns to be of a classical Jara Samprapti, then invariably Lankhana is the most important and perhaps the most effective tool. So in the asymptomatic stages, it may not be so important, but with the onset of symptoms of Nijajvara, Lankhanam is most important. No doubt, Lankhanam, Upavasa Rupa Lankhanam need not be extreme fasting, but Leghvasana Upavasanam is perhaps the most effective tool in the management of almost all types of Jvara. And Yavagus, the other day, Ministry of Ayush was preparing a document for the management, care and treatment of the post-COVID symptoms, and we were discussing. Fortunately, I was also a member of that team. And we were discussing about the importance of Yavagu. We should read the area in Charaka Samhita which discusses this Yavagus. Jvare lankhanameva adau upavidishya. Sorry, that sloga is Jvare lankhanameva adau upadishtam. Jvare lankhanameva adau upadishtam. But except there are certain areas where it is not advised. Hrude jvarad kshayanila bhayakrodha kamashoga shramodbhava. In such situations, it is not advised. But in general, jvare lankhanameva adau upadishtam. Lankhanena kshayam nide doshe sandhukshide nale vijvaratvam laghutvam ja shut cha eva asya ubajayade. So that sets an excellent platform for normal, safe recovery from the jvara. And while opting for upavasam, Lankhanam, Balam should be taken care of. Balam yatnena palayan, baladhishtanam arogyam, I already mentioned earlier. So that is very significant. And we find many Yavagus interesting, and the importance of Yav. See, Charaka tells, Tascha bheshaj samyogad leghutvad cha agnidipana. That seems to be the most important property in our context. Tascha bheshaja samyogad leghutvad cha agnidipana. Then Vadamutra purishanam doshanam cha anulomana. Proper gati, proper sanjaram of Vadamutra purishanam doshanam cha. Then Svedanaya Dravoshnatvad, advantage of Yavagu, bonus. Food is your medicine. If I understand, I think there is a session on payas in this Ayurtarang program. Dravatvad Trit Prashandaye, Ahara Bhavad Pranaya, Saratvad Lakhavaya, Jvaragnyo Jvarasatmyatvad, Tasmad Peyabhiraditaha Jvaranupajare. So you won't find these sort of advices in any other stream. It may take another 1 or 2 pandemics for the Western medicine to incorporate the concept of Yavagu in their textbooks, I think. Similarly, the advices given, documented by the acharyas, like Gurushna Snigdha Madhuran Kashayamscha Navajvare Aharan Doshapatyartham Prayasha Padivarjayed. You see, Gurushna Snigdha Madhuran Padivarjayed. So you have no space for giving milk to a patient with the excuse that it is a viral fever. Similarly, Pitta Viruddhani Tyajed, Pitte Adhige Adhigam Tyajed, Snanabhyanga Pradehamscha Pariseshamscha Lankhanam. Don't go for extreme Lankhanam. Similarly, advice about the Aushadhajirnam. Vaidyas commit that sort of mistakes many times. In some sort of a craving to find effective medicines which can substitute paracetamol, we end up in over-medicating the patients. That should not happen. Because most of our medicines require proper dahanam, pajanam in Agni. So when the Agni is already weak, you are not supposed to over-medicate the Jvarita. Na pibed aushadam tadhi bhuya eva amamavahed amabhibhuta koshtanam. That is how it is explained by the acharyas. Na pibed aushadam. So be very careful about prescribing medicines, especially in Jvara. Never think that more medicine, more effect, more result. And after all, we should incorporate all principles of Ayurvedic understanding. It need not be a drug-based therapy alone. Please keep it in mind. Regarding the food, it is very important. In different stages, we find many specific preparations, like when to give yusham, which all things can be used for yusham. So even if you understand it as a source of protein, forget it, doesn't matter. Even if you consider it like that, you will find specific areas See, Yusham for made out of Kulattam, Chanakam, Kalayam. So different grades of protein intake also you can see if you wish to see it in that light. Similarly, Kritam Kashaya Panapatyan Dashaha Idilinki Sapirdatyag Kabhe Mande Vada Pittotare Chure. Similarly, that Jaraksheenasya Mahidam Vamanam Na Virejanam Kamam Upayasatasya Viruvairvaharinmala Kshirojitasya Praksheenasveshmano Dahatripadaha Kshiram Pittanigarthasya Patyamapyadisarinaha. So when to give Kshiram, when to give Kritam, when to give Yusham, when to give Mamsarasam, all these things are very, very well documented. These are the crux of Ayurveda, Jara Chikitsa. Don't forget. And ultimately, you see, in the case of Vishamajara, Anandujara, all these things, make sure that the patient is comfortable in terms of peace of mind. Karunadram Manashuddham Sarvajara Nivaranam. It is not about creating fear, panic, sense of insecurity, but it is all about comfort, peace of mind, sense of protection, safety. Karunadram Mana Shuddham. Karunadram Shuddham Manaha. Karunadram Shuddham Manaha Sarvajara Nivaranam or Sarvajara Vinashanam. So please keep all these points in mind. I think another 15 minutes we will use for some clarifications if at all some doubts are there. Once again, I extend my happiness and gratitude to the team Ayurveda who is behind this great endeavor. Thank you all for patient listening. Thank you.
Thank you. Thank you, sir. As always, your class was wonderful. And as you said, from now on, we'll go more to our basic texts and instead of short texts, we won't use short texts. So, shall we move on to question and answer session?
Definitely.
Okay, so one has asked, what are the anti-gastric medicines we can give?
What are the anti-gastric medicines?
Yeah.
You mean? I think I did not get the question clearly.
For anti-gastric medicines, that is what is asked.
You mean the point put in the chat box?
Okay.
That is what you're mentioning?
Yes, sir.
Oh, I think that is about the list of, or it is one among the most commonly misused medicines, which is making the situation complex. I was mentioning about the different types of anti-diabetic medicine or that anti-cholesterol medicine, many things now. So I think here the one who asked the question, Dr. Ashwin, was adding that these anti-gastric medicines are also an issue these days, which are very frequently prescribed, causing problems with the proper understanding of the disease. Yeah, he's mentioned it is not a question.
Okay, sir. Okay. Sir, supplements like calcium, B complex needed for preventing osteoporosis. Can we give Ayurvedic medicines to replace these? And if yes, for how long?
See, again, it's an interesting point. See, we should have a correct idea about what we are going to address. When there are issues with the so-called deficiencies or osteoporosis, don't get stuck at that juncture and try to solve the problem in that plane. Come back to the basics. It is all about doshadhadumala moolam sada dehasya. And it is not to be something which is addressed from the very peripheral plane. So you should understand the mechanism of how dhadus are receiving their poshana, how Agni is contributing in it, how far the ahara is important, and what is the role of the srotas in the proper distribution networking of the ahara sara. So if at one point there is a deficiency, you should find out which of these four elements, that means ahara, agni, then srotas and other elements of the dhatu agni like factors, which has gone wrong and which can be addressed to reverse the issue. But still, there may be some situation where an emergency intervention is required. So in such situations, you can use the concept of samanya vishesha. Dhadavaha khalu shariraha samanaihi samanaguna bhujishtaihi va dravyaihi vruddhim apnuvanti. So in such situations, you can use these sort of agents in the form of food or supplement or whatever it is for emergency management. I don't mean that you should use the synthetic or artificial molecules which are available in the medical stores, but you have your own versions. But ultimately, the correction should be made in the level of the previous four factors which I mentioned. So that is how Ayurveda addresses these sort of issues. I hope it is clear.
Okay, yes, sir. Sir, one personal question. So for post-COVID complications, many are suggesting Chyavanprash, such rasayanas. Is it correct way of treatment?
Yeah, see, again, I think the post-COVID situation has evolved greatly in the maybe last few months especially. Previous picture was so generalized, but now we have a list of specific issues post-COVID. So prescribing based on some general concepts need not work in each and every case. As a general strategy, as a general rasayanam, if the individual has got good Agni Deepti retained after the main infection and certain amount of that weakness or related issues of dhadukshobham, rasakshayam, etc., Chyavanprash may be a choice, doesn't matter. But you should not limit your post-COVID management to the consumption of Chyavanprash. You have to understand specifically what is problem with the individual. Again, an issue of customizing the prescription. Sometimes it may be all about loss of sleep. Sometimes the persisting gandhanasham or rasa ajnanam type of issues. Sometimes it may be agni nasham. Sometimes it may be body pain. Many things. So in such cases, I think you cannot go for an outright prescription of Chyavanprasham for one and all. Sometimes there may be residual issues like lung fibrosis. So you will have to go for more specific medications, always keeping the Agni intact. Sometimes Kushman Rasayana may be making a better prescription. Sometimes Agastya Rasayana. And in one situation, you may require to go for Brihat Chagaladhyam Khritam. To start with, sometimes Elaganadi Kashaya may be the best. So don't generalize the post-COVID management to Chyavanprash.
Okay, sir, I got that. So many are telling the lack of sleep after COVID vaccination. and it's very difficult to retain that condition because some of patients, even after giving Chandana Savam, Ashwagandha, Adishtam, they still have the problem of lack of sleep. So anything we can do for this?
Yeah, there are multiple strategies. Number one is, if somebody is going to get the shot, start giving some Jarahara or Agada type of medicines prior to the jab, maybe 2 days prior to the jab, and also continue it for 2-3 days after. Best options could be Sudarshanam Gulika, Vidvadi Gulika, or Drakshadi Kashayam. Don't give all together. Either Sudarshanam Gulika or Vidvadi Gulika or Drakshadi Kashayam. And if even in spite of all these things, there are incidents of this Nidranasham, I think this Drakshadi Kashayam, better in a Panam way with the classical ingredients like Yuktam Madhusida Lajai.
Okay.
That works very well.
Thank you so much, sir. So I think that is over. Question answers. Okay, sir. So now, thank you so much, sir. Anybody who have further doubts can post in the group. And we are ending the session, sir. Thank you so much for coming, and your presence itself is a blessing for us.
Thank you very much.
Okay. Okay. Thank you, sir.